And so board members will move on from this celebration to information as is regular in our board meetings about COVID-19. I'll turn to the county manager.
Thank you, Madam Chair. Members, today is information set up in the packet where it links to our dashboard, more than a full-blown update. I did have just a brief update to share with you, however, and we do have Dr. Ogawa and Deputy County Manager Hadeen with us on Zoom today if there are specific questions. Right now, we're in this space where cases are low, and that's a good thing. Transmission rates are down, that's a great thing. And we've seen an uptick in vaccination, as you've been able to read about in the paper, I'm sure, as we go forward. All of those are good things. The variants showing up in Minnesota and across the country, and really this is a global pandemic everywhere in the world, is a big concern because the vaccines do not have the same level of effectiveness depending upon the variant for which we're talking. It'll lead down the road of the need for booster shots, as Dr. Ogawa mentioned last week. And so waiting to see what happens with the variants and their potential to quickly explode in terms of case numbers is going to be a big deal. Waiting to see state direction to go from 1A to 1B and through that list beyond so that we can vaccinate as many people as quickly as possible in an equitable way. And tomorrow is our first large-scale clinic from 1 to 7 p.m. It's scheduled to vaccinate 800 people from healthcare with a little bit of education mixed in as well. So things continue to ramp up as uncertainty in other areas creeps in. Just this morning From the County Manager video that was recorded that'll go out with our message today. Oh, I'm sorry. I mentioned that let me step back on one thing I said. I'm getting a real-time update of where I made a mistake. The large-scale clinic is today from 1 to 7. I said tomorrow because I got my update yesterday. So today from 1 to 7 p.m., 800 people from healthcare and education will be vaccinated. I apologize for the misstep. From the County Manager column today talks about the idea that we said we would check in with our employee base on or around April 1st for our return to work status and where things stand. Today's column will say, we're going to continue to go a few months at a time on this conversation as we continue to learn more as we go. Memorial Day is a better check-in time at this point than April 1st. So we said, as of now, we're going to maintain the current work environment that we're in up to at least Memorial Day, with a check-in again coming a little bit before that. And we will continue to keep everyone posted as we go. We continue to work on a flexible work from home policy that will help us a flexible workplace policy that'll be with us beyond the pandemic as well, and hopefully guide what the future of our organization looks like, and looking forward to talking about that more with all of you in the months ahead. That's all I've got, Madam Chair. Dr. Ogawa and Deputy County Manager Hadeen are here along with me to answer any questions any of you might have. Madam Chair, you were on mute if you called on somebody, I think.
Okay, so that's why Commissioner Reinhardt did not speak up. I will call on Commissioner Reinhardt. Thank you.
Thank you. Well, I have a very simple question, because the question that I keep getting and trying to, referring to someone else is, how does somebody check to make sure they're on the list? If they've signed up, it seems like it goes into Never Never Land. And so it seems like a silly question to keep forwarding to someone, but how can somebody check? For vaccination, obviously.
Sure. Madam Chair, Commissioner Reinhardt, I'll do my best, but I'm going to then go to Deputy County Manager Hadeen if she can add to this, or Dr. Ogawa. Since the state is managing most of the vaccination pieces through a website, I don't know how much, I can't tell you specifically then how that list effectively gets managed. Kathy, can you share any specifics of what we know behind the scenes to that answer, or is there any information that we could hunt down to get a better answer on that?
It's a good question. I think, and it's tough because a lot of people have called and they've gone online and they've gotten their names on a list and they get a note, and sometimes it says, we will get back to you, so please be patient and wait. And that's unfortunately the guidance right now is to be patient and wait. MDH is managing those lists and they are calling people to get people into vaccination clinics. The same goes for, if you have a healthcare home, keep connecting with your healthcare provider to check on whether or not they have appointments available for vaccine. When it comes to organizations who are in that phase 1A and you've gone onto our website and put your name into the employer list, we do keep track of that list. Some of the places are being managed by NDH, and we work with NDH to compare our list to make sure that when an organization is contacted and is vaccinated, that we remove them from our list. But people can contact our site as well. You can go onto ramseycounty.us/coronavirus and check in with us to see where you are at on the list, and we can help you as well.
And Madam Chair, Deputy County Manager, but the list through Ramsey County is not individuals, it is organizations, and then within that list, hopefully it's an organizational list.
Correct.
So it's a very different list than what's with the Minnesota Department of Health, and I want to make sure that people understand that as well. Okay, thank you. You're on mute, Tony.
Yep. Yes, I'm sorry. Commissioner Fretham.
Thank you, Chair Carter. So I know I had exchanged a few emails with the Deputy County Manager about this, but questions regarding staff who provide home health care through community-directed community supports grants. Because the person getting the care is the employer at record, it seems like they may be falling through the cracks in getting on vaccine priority lists or being identified. So just wondering if you've got any more information or updates about that, in terms of the most vulnerable in our community, wanting to make sure that we are catching folks who have really been impacted by this, both for their own vulnerabilities, but also their staff and challenges in getting that support.
Madam Chair and Commissioner Fretham, I do appreciate that you brought this to our attention. This is a tricky one because of what is provided to us through the Department of Human Services at the state level. I had to do a little learning here too to understand that people are indeed considered the employer here. And so this is a gap that we are working with both our Social Services Director, Ann Berry, and with the Minnesota Department of Health to make sure that we are getting the appropriate lists of people that we have within Ramsey County to make sure that they are indeed on lists and that we are finding ways to make sure we are providing them with vaccines. So we are still in the midst of gathering that information and happy to return a follow-up message to you once we have an identified plan. It's possible that some of these people are getting vaccine and I'm just not aware yet, but we will have follow-up for you soon. Thank you for bringing it forward.
Thank you. I will call on Commissioner Matas-Castillo.
Thank you, Madam Chair. I just wanted to share one additional resource. I know we've talked about it in the past, and that is for any veterans who get care at the VA. Yesterday, there was a clinic for vaccines at the Minneapolis VA, and it was show up at 8 o'clock, and by 10 o'clock, all of the 400 doses of, that were allotted were distributed. But for veterans who want a little more assurance or to have some information, they can go on va.gov and sign up to get updates. So when there are vaccines available at the Minneapolis VA or other VA clinics, they can get an alert so that they can get that vaccine. They're currently giving vaccines to veterans who are 65 and older and veterans who are care providers. Or medical care providers, or in the certified care provider program that they're caring for a disabled veteran. So some spouses. I participated in a national update from the VA last Friday talking about the rollout and the vaccine distributions. And so as we've heard week after week, it's complicated. Ramsey County is working really hard. The state of Minnesota is working really hard. And so I would encourage veterans who have the ability to access through the VA, that they use that system. so that they're using the vaccines that are available, and we can get more to community in this really complicated system. So it's va.gov, and there's a immediate pop-up comes up to say get informed, and you'll get email and text notification when vaccines are ready for veterans.
Thank you very much for highlighting that, Commissioner Mattis-Castillo. And that is for veterans, not only who are served through the Veterans Administration for medical care, but for all veterans. Is that correct?
That's correct. It is for all veterans, even if you don't currently have an active case or you haven't already enrolled. If you have a veteran status or your DD-214, which would make you eligible for that vaccine. If you're already enrolled in VA healthcare, then you're in the system and you don't need to bring any additional documentation.
Thank you for your attention and provision of that information. Commissioner McGuire.
Thank you, Madam Chair, and thank you, Director Hadeen and Dr. Ogawa, for all of your work. These questions just keep coming, and we know that there aren't answers to all of them, and I think mine will be the same. It's about people who are actually caregivers in the home with a person who is eligible. I've heard the inconsistency is where this question comes up, is that so people said, no, if there's a caregiver in the home, they can also get the shot when they bring their when they give the eligible person in for the shot. But we're not, is our state not at that point, or is our county not at that point where if you're actually living with the caregiver, you're the caregiver living with the person who gets the shot? Do you know anything more about that?
We're both waiting to see who's going to answer this one. Madam Chair and Commissioner McGuire, it depends is the answer. This is tough, right? We all, not all of us, but many of us are around people who are eligible, but we're not eligible because we don't fit into those phased guidelines. So it really depends. If they're the actual caregiver and they're down as the caregiver, then they, as for home health care, that would put them in an eligible group. But still, how you get the appointment, where you get it, it is complicated, and it does depend. So it's not necessarily the case where if the person eligible, say the older person in the home, did finally get their appointment, they went in to get their appointment, that there is a vaccine for that caregiver. There likely is not, because they would need an appointment at that time. Dr.
The only thing that I would add also is that because there are different organizations following different current levels as well. So let's say an individual, the VA may have enough to offer to the caregivers as well. That's a wonderful situation. Health partners may not. They are only contacting their patients actually over 75 right now. And so they would only be allowed to get a vaccine with the person that they are taking care of if health partners, if they met health partners level of need as well. We as a county are still providing it to caregivers, and then we will gradually expand. But yeah,
it's just interesting, and I'll confirm all of that. Since my mother got the shot last week, and I was going to bring her in, and I'm her main caregiver, but they wouldn't give me the shot. I'm not quite 65 yet, and I said, but what if something happens to the caregiver? But that's okay. I'm glad my brother, the teacher, got the vaccine, and I'm home. So, but it's just, I feel bad for other caregivers who may not be in my situation, who really do, my mother depends on me, but other people who really depend on their caregivers. So it's a tough one. But I've heard other states where they say, oh, no, if you're the caregiver, you get the shot. But that's just what you hear. So is this a state rule or a federal guideline?
It sounds as though it's being interpreted in different ways. Dr. Ogawa?
Yeah, the short answer is yes to all of that. Unfortunately, it's the interpretation of a federal recognition of the rollout, and then there's a whole lot of levels of interpretation.
Mm-hmm. And so we are working through it. Thank you for raising the issue and focusing our attention, Commissioner McGuire. Kamiga. Commissioner Ortega?
Thank you, Madam Chair. My question is very similar. In the last week or so, I've had Zoom meetings with various folks from the disability community. And you kind of explained it all. I mean, number one is many disabled folks are not in the first tier, the 1Bs, the 1As, or whatever. And quite frankly, let me tell you, they think Ramsey County is doing a wonderful job, but so they're not. It was good meetings because it's convoluted. And I guess I'm changing my question after hearing your answers to everybody else. And that is, we need to help folks clarify, and I know this is hard, the federal, the state, the county, folks this is no longer, you could be as educated and as sophisticated as hell. And you still don't know what's going on in many cases. And so I don't know what I'm even asking you, because I know you guys are doing a great job. But this is getting to be very difficult. And they do have, these advocates have a meeting with the governor's office this week to talk about these issues. But I'm scared that only convolutes, so you keep adding rules on top of rules on top of rules, and pretty soon we need to have people just to figure out what rule book we're going to. So I just, how do you see this unfolding? Do you see any, these lists are just going, they're not being helpful.
Madam Chair.
Thank you. Go ahead.
Madam Chair, Commissioner Ortega, I'm going to take a shot at a little bit of this because it kind of moves into that area of how we interpret, right, as you've been hearing, with gray areas that will only get larger over the next couple of months. I don't think it's going to get more clear. It's actually probably going to feel even less. I think the spot that we will continue to work on, and we'll check back in on this with all of you next week, is it's less about how we communicate the strict the categories right now of individuals. We're doing that. The point you're making is that even when you do that, it's very confusing. How we are choosing to then do our best to prioritize within that and make decisions in the moment there's some principles that underpin that, right, around access and equity, risk, ensuring we use every available dose, and we can do some more to continue to make that information also available alongside it, which it's not going to answer every question. I don't mean to pretend that it will, but it helps people understand in our brains how health officials on the ground are doing their best to make these decisions as people present, and we have to make them. And that's something that we can keep working on and keep making the information stronger, and we'll come back next week and talk about that some more.
Thank you. In the meantime, we'll move along. We have one final question here from Commissioner McDonough.
Thanks, Madam Chair. Real quick, if you recall, a couple weeks ago, I brought up the issue about seniors, my mom being one of them, who lives in independent living, 89, every risk factor that they possibly can have, but wasn't considered long-term care because it was independent living and frustration, all that. I do want to maybe end on a good note story. My mom called me last Friday. My sister took her in. Her health plan is getting shots to 75 and older. She got her shot, and she called me up, and she was just so excited, and she's looking forward to two things: a hug and going shopping at Target. And I tell you, the frustration you hear from everybody, but the impact that this has on people in our community is just amazing. So every single one of those shots is so valuable to somebody. But I wanted to end on a good news story here. And I'll be giving her a hug here. She gets her second shot on March 3rd. She actually said, "You've had COVID, so you've got the antibodies. I've had the one shot. Maybe we could do it quicker."
Thank you, Commissioner, for that good news story. We appreciate it. We also appreciate all of the updates and information here, responses to our questions, and we know that we are working our way through, perhaps through confusion, but to additional clarity as time goes by and as we are continuing to fight this COVID-19 impact in our community. I do want to pause for a moment for our intentional moment of silence and recognizing all of the struggle, continuing ongoing crises in our community, as well as the work that we are collectively doing to combat COVID-19, the economic stress and social stress in our community. That moment. Thank you. It was a short moment, not completely silent, but I thank you for your focus on mindfulness as we move forward. I'm going to just check back in with the county manager in case there are any final statements before we move on.
Yeah, Madam Chair, I have one actual quick question for Kathy. I'm going to put her on the spot. I think she'll have the answer on it, so hopefully it's fair. Kathy, so the 800 individuals who are getting vaccinated today, you talked last week about how we were holding a number of vaccines back for some events to occur, and that was also having an impact on our supply and our data and what it shows. Is this one of the events that'll bring down that supply number? Would this relate to some of what you were referencing last week?
Madam Chair and County Manager O'Connor, that's a good question. Our colleague Laura, who makes sure that where we're at on our dashboard with numbers, is out on vacation this week. I am actually not sure if these are first doses or second doses. It could actually be a mixture of both, is what I'm thinking, since it's a very large number that we're vaccinating today, especially since we're bringing in some educators. I would think that it's their number twos. So you will see that this will get a big chunk of our current lot of vaccines down. And as we continue through the week, we have multiple clinics as well that we will chop at that. We're also working with the Minnesota Department of Health because, as you know, the state does want to try to move to 1B, and it's a little bit difficult within Hennepin County, Minneapolis, St. Paul, Ramsey County, because we have so many employers and businesses with people who fit into the 1As. And so actually MDH is working with the larger local public health departments to get at that number as quickly as possible so that we as a state can move on to 1B as well. So hopefully some good news in that area and movement soon.
Thanks, Kathy. Final follow-up comments from me. In that you heard that Laura's taking a couple of days off this week. I want to first give credit to Kathy for convincing her to do it. And the reason I bring that up with the board is, at the end of the year, we sought to get leaders, particularly those who had been working across the incident management structure, but leaders actually across the organization. I sought to ensure that they got at least 3 days off. Many people had not had 3 consecutive days off the entire year. And it was a fight to even carve out 3 days over holiday times because it just doesn't get quiet right now. Public health, there were folks who couldn't do that at the time because that was the beginning of the vaccine rollout and there was so much else going on. And the director of public health here today has until the end of February to get some of her team some days off, or they're going to all get some mandatory days off. And so I'm really happy to hear that Laura's taking some time. I'm trying to make sure that Kathy and Dr. Ogawa can as well. And I just bring that up from the human side of this response. The same folks who've been leading testing for 12 months are now showing up on the vaccine side, and we're doing what we can to carve it out. It's just impossible to find a good moment, and so we're doing the best we can to find a moment. And and so thanks to Kathy, and I know it's not a lot of fun to take time off when it's 16 below out. My final comment will just be to reflect back on the comments that a number of you made today. I wish we had better answers, and I'm sorry we can't give you more definitive stuff. What we often are able to do, though, is hear what you're saying and what you're hearing and reflect on that over the week. And every week, our goal is to just get a little bit sharper. And so in our answers, it's trying to reflect the best info we have while also saying, like, your comments today we'll take back and be reflective of and see where we can continue to build on it. With that, Madam Chair, thank you very much.
Thank you. Sounds fair. And to Dr. Ogawa and Deputy Hadeen, we hope that at some point we will not see you on our call. We'll know that you're out and taking your 3 days, such as you deserve. Thank you so very, very much.